So here's the video looking at knee rotation. So the knee, as well as flexing and extending, the knee also rotates. So this movement happens kind of below the kneecap, the patella, and we're thinking about this tibial area here, rotating one way, rotating the other way, underneath the knee. And that action happens by the hamstrings. So for everything to turn this way, the hamstring that attaches at this side of the knee gets really long and the other one gets short. And then when we go the other way, it happens the other way. So there's like this puppet motion happening at the hamstrings, and that feeds the lower limb and allows it to rotate. So we want to be trying to keep everything above the knee still because we want to keep the movement in the lower limb. And we start quite simply by taking the toes one way and the heel the other. And we use the movement of the foot to drive that rotation. And then we go to the other side and we're rotating the other way. So it's just this, it's a very subtle movement. You might not even be able to see it on the camera. I'm going to come a little bit closer. So what we're looking for is change underneath here as I rotate. So there I'm rotating externally, and there you can see it internally. There we go. So there's a good view there. There's the internal rather, and as I come externally, you can see the hamstring fire and you can see it pull all the tissue that way. Internal, external. So if we can try and get that view on the other side, there's the external, there's the internal. There's the external, there's the internal. Just to show you with the foot again, we're taking the toes that way and the heel the opposite, and that's driving that rotation. Then we take everything the other way, that rotates that way. Very small, subtle movement, difficult to see. And that is rotation at the knee.